Hey there, this is Dr. Evan Osar. Do you have clients that have low back pain when they do things like bend over and grab something and or are working in their garden? Well, in this edition, thank you first for joining us here in Facebook Live and or wherever you're watching this video. Thanks for being part of our community. Thanks for allowing us to share this information with you so that way you can better help your clients as well with common issues like low back pain. Now, if you've been in the industry for any length of time, you have heard things like, hey, we just need to get our clients stronger. And again, for most of our clients, yes, more strength may help them and probably will on some level help them as well. And that's part of our responsibility is to help get them stronger. However, I want to share with you just the results, not necessarily so quick, but the results of a recent study that came out 2018, so relatively recent. Seems like so long ago now, right? 5 years ago, where they looked at low back pain in athletes versus non-athletes. So they took a small group. Again, most of these studies are small groups of individuals, so we have to be careful of how much information we take from these studies. However, they compared elite athletes, so athletes competing at a high level, with non-elite athletes as well as general population. So about 15 people, there's 30 groups in the elite athletes, there's 15 non-athletes, and 15 people that didn't work out at all. And they compared them, they all had chronic low back pain, so they compared their strategy, how their nervous system responded to different lifting, isometric lifting, as well as perturbation. So if they just jostled them, how did the muscles react? So what did they find out? Did the elite athletes who trained easily 11 to 15 hours per week compared to either non-training or just a couple of hours a week training in the non-athletes, how did it compare? Well, you may be surprised to find that the elite athletes showed the exact same strategy that the non-athletes and as well as the sedentary people showed. So chronic low back pain the strategies are very common across a group of population, regardless if they're training at a high level and or not. So what did they find? Well, number one thing that we find in a lot of these studies of individuals with chronic low back pain is they use a very similar strategy for all their tasks. And one of those strategies is they tend to overly brace and over compress. Meaning that when you sit down in a chair, for example, sit down on this bench, for example, and then you stand up and then you just go for a walk, you should have a very low level of core activation and activation of your lumbar erectors, for example. Yes, they should be working. Obviously, they need to maintain you upright against gravity. However, there should be a relatively low level of activity because you're doing low level activities, sitting down, standing up, walking. However, even in elite athletes who are stronger, way stronger than the non-athletes as well as the sedentary population, they have overactivation of muscles, their core muscles, like lumbar erectors. So what does that tell us? Well, when your body senses instability or has a history of discomfort, it's going to overactivate some of these muscles. There may also be, what they've also found, is delays in timing. Some of the deeper muscles, like transverse abdominis, the pelvic floor, the lumbar multifidi, compared to the more superficial muscles that become overactive in chronic pain, for example. So we see the very similar pattern in our sedentary population as we do in elite athletes. The other thing about this concept, about the strategy that athletes use and people with chronic low back pain, is they don't change their strategy, as I mentioned. So for example, like when you're walking, you should have the ability to step and rotate and then counter rotate. And that's what makes efficient walking. That's what helps your balance as well. Well, if you're not changing the strategy, and you're not allowing the individual, or the individual isn't allowed to, should say that their strategy isn't allowing them to rotate, counter-rotate, and just move very efficiently, optimally and or efficiently, well then they have a very guarded gait pattern or walking pattern. So this is where you see a lot of your clients, they have a very shuffling type gait. They may not pick up their legs very easily. They may not actually create rotation, counter-rotation. And what they often do is they'll start moving too much through the frontal plane. And that's the other finding they found is a lot of these individuals with low back pain, even elite athletes, they start to move more through the frontal plane than the transverse plane. And that leads to not only low back pain, but it can lead to knee problems, shoulder problems, neck problems, and other issues where you have to compensate for the lack of rotation. So, understanding this, what can you and I do as health and fitness professionals? Great question. So what we want to do is, number one, figure out a strategy. Number one, learn how to assess our clients. We want to assess our clients to see their strategy for things like bending forward, like things like bending backwards, standing on one leg, squatting, rotating, and doing other functional activities that they may do in everyday life. That gives us a sense of, hey, how do you do things in everyday life? Even though, yeah, your clients can cheat the test, most of your clients aren't body-wise or aware enough. Some of your athletes may, but most of your general population clients, they're not going to cheat so much that you can't find their strategy if you watch them and evaluate them. So here's just a couple of easy, simple assessments you can do. There's way more about this in our series, our Two Anatomy Geeks series, the anatomy of common spinal and neurological issues of the spine. Is what you can do, have your client do, is you can do a standing rotation. We'll do a seated and a standing rotation. First, you have your client just stand, put their hands on their hips, feet together, keep the feet relatively flat on the floor, rotate to one side, come back to center, rotate to the other side. And do you notice a difference in side to side? Not only the range, and also, I should say, but also then the ease. So for me, rotating right, very smooth, very easy, no problems, and rotating left, little bit stiffer. So again, not a big difference, but there's definitely a difference here, and my tendency is I want to roll to the outside of my foot when I rotate to my left. So definitely a difference side to side. Why is this so important for someone like me that's a right-handed athlete? Well, if I'm playing pickleball, which I tend to do, as I rotate to swing the racket, because again, most of the time I'm swinging this way. Yeah, I'll do some backhands sometimes, but my backhand sucks, so excuse my language. But my backhand isn't so great, so I'll switch so that I can hit a better forehand. It's a little bit more accurate than my backhand, even though either one is not so great. However, if I can't rotate very well or don't rotate very well around this left hip, well, then I'm gonna have to compensate through my shoulder, through my neck, through my elbow, and that's where a lot of lateral epicondylitis will come from as well, and or shoulder and neck issues. So very easy assessment. Now for higher level individuals, maybe they're not aware of that as much. Well, now you can just do stagger stance. So now just put one leg in front of the other leg. So now I'm going heel to toe, hands on your hips, rotate. So my right leg is forward, rotate to the right, no problems there. Rotate left, heel to toe, left leg is forward, rotate left. Now it's a little more obvious for me to notice that I have limited left rotation. Now you've seen hip rotation, let's look at trunk and spine rotation. So now we'll sit, and I would normally use a yoga block between the legs. Sorry about that you can't see me, but I'll use this medicine ball, I'll put it between my feet, and I'll squeeze it with my tibia just to keep my lower body stationary. Because what you'll see with a lot of your clients, it's hard to see just because of the camera angle, apologize for that. But if your client loses rotation, you'll see them start to really start shifting their pelvis on the seat. So the nice thing about the yoga block, or in this case, the medicine ball between the lower legs, is it helps to keep the legs and lower body controlled. So again, cross the arms. And usually what I'll do now is, if I'm rotating left, I'll cross this hand over this way, and then I'll rotate left. And when I rotate right, I'll cross the right hand over this way and rotate this way. So I'll do it standing just so you can see it easier. So I'll put my back to the wall, lean forward just a little tiny bit. So here's my right rotation. So I'm gonna rotate right and go slow, because a lot of your clients will do this, like, oh look, I have good rotation, and it feels the same side to side. So really go slow, get a sense of how far you can go. Do you have to compensate? Watch from the front, the back, the side, and then cross the other hand. I'm gonna rotate left. And for me, right rotation, a little stickier, a little stiffer going to my right. So now, again, go back to what I like to do. I like to play pickleball in addition to lifting weights. So again, if I can't rotate, so backswing, that's my backswing, that's gonna make me compensate. If I have trouble swinging through my left hip, well, now I have to start to overcompensate through my trunk and spine and or through my shoulder to compensate for the lack of hip rotation. So look at that in your clients, regardless of their physical activity, and you'll start to see some of their patterns. Now, you've seen that, what do you do about it? Well, we use the principles of the integrative movement system, ABCs. First, we want to help our clients better align. Aligning the head and neck, aligning the thoracolpelvic cylinder, aligning the thoracolpelvic cylinder better over the feet. You'll do your myofascial release to help you better align. Then from there, we want to do three-dimensional breathing. Why is three-dimensional breathing so important to your clients, changing your client's strategy? It's because once you better align, and breathing will help your client better align, well, now you're creating more mobility through that thoracolpelvic cylinder. You're breathing three-dimensionally, front to back, side to side, as well as top to bottom, and that creates the ability to lift the ribcage up off the pelvis, up off the hips, and suspend. I'm working with an 82-year-old woman, wonderful woman. When Carol first came in to see me, she's like, yeah, my knees really hurt, my hips really hurt. You know, I'm getting some low back stiffness as well, especially after I've been sitting for a while. And, well, her mother fell, so when I said to her, your mother? Like, She's like, yeah, my 102-year-old mother fell. She's like, she fell and broke her hip, so now she hasn't been able to do her exercises. But she's like, I do exactly what you asked me to do, Dr. Osar. What I do is I suspend my rib cage up, I do some breaths, and it takes the pressure off my hips and off my knees. So again, if it works for an 82-year-old client, who can't it work for, okay? So think of the idea of suspending, doing that three-dimensional breathing. Now we want to teach your clients how to hinge. So we think about hinging. Obviously, you can hinge with feet parallel. But one of the best ways to address hip rotation issues is with a split stance rotation or split stance hip hinge. So you've seen me do this before. Align that thoracopelvic cylinder, keep that cylinder aligned, hands on the pelvis, step back. So now my left leg is forward. That's more my stiffer side. I'm going to breathe in, breathe out, and hinge, really focusing on the ability to move that cylinder over top that femoral head. And when your clients do this well, they're rotating, or should say they should feel it stretching through the backside of that forward hip. And they come back up without over gripping. Yes, they're using their glutes. They're just not over gripping to pull themselves or push themselves or grip themselves back into that posterior tilted position. They're coming up tall. So they're hinging and then coming back up tall. And again, once your client gets better at this, again, down the road, you can teach your client how to hinge and then rotate. So now you're teaching them how to rotate around the pelvis, around the femoral head. So now you're teaching them how to control hip rotation and develop the ability to hip rotate. And if you do this a few times on your stiffer side, you should feel, so now just shake it out, bring your feet back together, hands on your pelvis, rotate to the right, come back to center, rotate left, much freer. So now I have much freer hip rotation to the left. And that's without any myofascial release or any stretching and mobilization. Obviously, you'll throw those things in. What about thoracic rotation? Now, for some of our clients, our older clients, they don't have great thoracic rotation. So there's different ways you can get that. One of the first things you can do to help improve thoracic rotation is do some kind of wall plank. So I'm gonna flip around so you can see me from behind. My hands will be on the wall like this, and I'm going to focus on lengthening through my spine and using my hands to use the scapular stabilizers to help me lengthen. So again, it's that long spine, hands on the wall, step back, going to push away from the wall, lengthen the spine, breathe, focusing on keeping that spine long, sending the breath all the way around the cylinder, keeping that length. And from here, I can do any number of things. So I can put one hand on the wall, and then I can do some rotation. Again, this may be a little bit more shoulder rotation, but you're also getting some component of thoracic rotation. So again, here, you're doing some rotation around the shoulder, which is still good for your clients. That will still help a lot of your clients with thoracic rotation. It's really a great way to train thoracic rotation. And if you go back and check your client, watch them walk before and after you do these couple correctives. Again, obviously you've done your myofascial release. Obviously you've probably done some other assessments. You've done some other mobility work. If you watch their walking before and after you do these few little things and you pay attention to the alignment, breathing control, you'll notice dramatic changes. And if your client incorporates these things into their daily routine, they'll be able to do things like work in their garden easier. They'll be able to walk longer distances. They'll be able to do the things they love to do, like play pickleball and do activities like that of everyday life, because that's ultimately why they're training with you. Yeah, they're training for longevity. Yeah, they want to look better, but most of your clients are coming to you because they want to live longer, more productive lives. And that's how you become that go-to specialist. You help more of your current clients and you attract more individuals that need, want, and will pay you for your expertise. I hope that made sense. I hope you either got reinforced by things that you're already doing well or a couple things that you can think about and or use with your clients. I'm doing more of this sort of concept. We're talking more about these concepts as it relates to low back pain with our friends at Functional Aging Institute this Tuesday at 7 p.m. We're going to do a webinar with them around low back pain and using some of these strategies. And we're also sharing the same information at the Functional Aging Summit coming up here in just a few weeks in Salt Lake City. So hope to see you there if you work with the older population. And if you're looking for just a resource that you can use right away to learn the anatomy of common spinal issues, check out Two Anatomy Geeks. The link is next to this video wherever you're watching it. Jill and I, my fellow anatomy geek, we go over the anatomy of the spine, common spinal conditions that like low back pain that's associated with disc problems and spinal stenosis and disc herniations and things that cause sciatica or long thoracic nerve issues and how that relates to some of the common issues you're seeing with your clients, like common tightness, common discomfort, and how you educate your clients, and more importantly, how you use your anatomy knowledge to help your clients. So check out the link, learn more about the program. If you want if you feel like it's appropriate for you and your clients that you work with, enroll. It's really a great community. It's a great opportunity to learn and to share some great information with you, to earn CECs, and more importantly, to help transform the lives of your clients. This is Dr. Evan Osar. Thank you so much for being part of our community. Thanks for watching. And if you are a veteran or have a family member, I should say, if you have lost a family member, I just want to give a shout out to all the veterans that have given their lives, the families that have sacrificed, for veterans that have passed away. This Memorial Day, we are celebrating those individuals who allow us to live in the greatest country in the world, who've sacrificed so much for us. I want to thank your families for your sacrifice, and wishing you the best holiday weekend. Even though it doesn't seem like it should be a holiday weekend, it is a holiday weekend. Let's remember those who have given so much for us so that we can enjoy the life that we live here today. Thanks so much. Have a great day. If you have any questions, just leave them below, and we'll talk to you soon. Take care. Dr. Evan Osar with Integrative Movement Insider. Take care.